Hello, welcome to my final presentation for NTR 581 in Spring Quarter 2018. My name is Irene, and my research topic was about increasing protein intake as a weight loss strategy. This PowerPoint presentation is based off of my popular article, Eat More Meat to Lose More Weight. Is it too good to be true? When it comes to losing weight and what to eat, you've probably heard of the same stereotypical advice. Eat less food and eat more veggies. But what if I suggest eating more meat? What if protein can help you lose weight? Let's check out what science says about it. First, let's talk about the three macronutrients that make up all meals: protein, carbohydrate, and fat. These three nutrients make up the total energy intake in certain macronutrient distributions. In 2006, the National Health and Nutrition Examination Survey described the average American intake composed of 15% protein, 52% carbohydrates, and 33% fat. Scientific research found that increasing protein intake to at least 20% of total calories promotes weight loss. Let's see the first study. A study done in 2015 found that increased protein intake increased 24-hour energy expenditure. Energy expenditure is the scientific term regarding the amount of energy a person uses in their everyday life. The higher the energy expenditure, the more calories are burned, which is good for weight loss. The study overfed 25 overweight subjects 40% more calories than their estimated energy needs, and were randomly placed in one of three intervention diets: low-protein diet, normal protein diet, and high-protein diet. The protein content in the low-protein diet consisted of 5% protein, normal protein diet had 15%, and high-protein diet had 25%. The patients stayed on their intervention diet for 12 weeks, and energy expenditure was measured in a metabolic chamber. Findings showed subjects in the high-protein diet group had immediate increases in energy expenditure since the first day of the study. Further investigation into the source of the increased energy expenditure found it was primarily from increased activity of residual mass. Residual mass refers to organs and tissues other than muscle or adipose tissue, such as the kidney, liver, or supporting tissue. Results further indicated that residual mass energy expenditure did not increase for subjects on the low-protein diet, suggesting excess protein was the factor that induced the increased energy expenditure of residual mass. This study concluded that excess protein increased energy expenditure due to increased energy usage from residual mass. So one way extra protein intake can help with weight loss is increasing 24-hour energy expenditure. Another study a little further back in 2005 found that increased protein intake decreased hunger and spontaneous caloric intake, which is eating not associated with a meal, like snacking. 19 overweight subjects participated in the same three-phase experiment study. The first phase, known as CRC1, had a normal protein distribution of 15%. Subjects were instructed to eat all of their food. The second phase, CRC2, had elevated protein intake at 30%. Again, the subjects were instructed to eat all of their food. The third phase, CRC3, had the same diet as CRC2, but was done under ad libitum conditions. This means patients could eat however much they wanted and whenever they wanted. Results during the high-protein phase CRC2 showed increased subjective reports of fullness and decreased feelings of hunger. With the same high-protein intake but under ad libitum conditions, subjects immediately consumed less calories, experienced a steady weight loss amounting to 4.9 plus or minus 0.5 kilograms by the end of the study, and significant decrease in spontaneous caloric intake. Further research into the mechanism behind the reported increase in satiety showed increased protein intake may enhance leptin sensitivity in the central nervous system. Leptin, aka the satiety hormone, tells us when we are full and when we should stop eating. Increased leptin sensitivity means the brain is more attuned to satiety levels and can signal the feeling of fullness faster. This study concluded that an increase in dietary protein from 15% to 30% at a constant carbohydrate intake produced a sustained decrease in ad libitum caloric intake that may be mediated by increased central nervous system leptin sensitivity, resulting in clinically significant weight loss. So far, one scientific study showed excess protein intake increased 24-hour energy expenditure, and another study showed increased protein intake increases satiety and decreases spontaneous caloric intake. Both studies found clinically significant weight loss in the high protein intake subjects. So how much protein is considered an increased protein intake? The recommended dietary allowance for protein for healthy adults is 0.8 grams per kilogram of body weight per day. Increased protein intake, according to the scientific studies, is considered 1.2 grams per kilogram of body weight per day. Before you start eating all the meat you can find thinking it will help you lose weight, please consider the possible contraindications for a high protein diet. Research is sparse, but there have been studies that show a high protein diet is not recommended for people with osteoporosis, renal disease, or colon cancer, to name a few. Please consult your doctor and/or dietitian to see if a high protein diet is suitable for you. Results from most studies were collected from healthy overweight subjects, so if this is you, it's potential good news for you. But what if you don't like meat? What if you prefer veggies instead? Well, there is good news for you veggie lovers too. Protein doesn't only come from meats, there are vegetable sources too. The most obvious animal-based protein sources are beef, chicken, pork, and fish. Plant-based protein sources are immense and diverse. Some choices include beans, soy and tofu, broccoli, and spinach. There are many sources of plant-based protein, but does vegetable sources elicit the same weight loss results as meat-based protein? Let's take a look at a scientific study that looked exactly into this question. A study tested the difference between increased animal and vegetable protein intake on energy expenditure. 12 healthy overweight men were fed low-fat diets and were randomly assigned one of 3 intervention diet plans. The 2 high-protein diets were either pork-based or soy-based, and the third diet had normal protein content. Findings showed that the subjects who had the pork diet had around 2% higher energy expenditure than those who had the soy diet. Both high-protein diets induced a greater 24-hour energy expenditure than the carb diet, which had regular protein content. This shows that as long as protein intake is increased, energy expenditure will increase as well. So whether you're a veggie goddess or a meat lover, increasing protein consumption is possible for you, and you may see improvements in your weight loss regimen. As a recap, excess protein increases 24-hour energy expenditure and satiety while decreasing spontaneous caloric intake, all of which contribute to weight loss. The increased protein recommendation is 1.2 grams per kilogram of body weight per day. And lastly, animal or plant-based protein is effective in increasing energy expenditure as long as protein intake is increased. Again, please exercise caution when designing your weight loss regimen. The recommendations in this presentation were assigned grade 2 because not all results can be applied to the general population and much more research has to be done. Always talk to your doctor or dietitian for the safest and most effective weight loss treatment. Thank you for watching my presentation.